Thank you, Brother Chair. Great to be here. Welcome to the hearing. Much of the funding for the CDC, which I'm proud to say is based in Atlanta, flows directly to state and local health departments. But the Trump administration's massive firings at the CDC mean that many dedicated expert staff are no longer there to assist and guide state and local health officials who are trying to respond to public health threats. And many grants that were already awarded to state and local health agencies are now left in limbo, with several multi-year contracts canceled by this administration, including some contracts that were already near completion. Mr. Chiarello, you're nominated to be in charge of financial resources at HHS. So please tell me, how is canceling active multi-year contracts awarded by CDC, some of which were 90% completed with most of the money already out the door, an efficient use of federal funding? To me, it seems unadvised and a kind of summary dismissal of work that's already being done and an ideological waste of federal resources. Can you help me understand why this makes sense?
Well, Senator, thank you for the question and for your interest in the topic. You're talking about our contracts that I have not had the opportunity to work in or understand the facts, as I've testified before. I'll follow the law when it comes to the allocation of funds and the management within the agency. And so,
welcome to the hearing, and congratulations to you and your family. I questioned a nominee about similar contracts a couple of weeks ago or last week, and I'm hearing the nominees come up here and say, I'm going to follow the law. That's good. I support that. It's basic, but it's good. But I'm asking you a management question, if this makes sense.
So understanding the issues from my perspective requires learning about the issues and leaning into the operating divisions to understand how those decisions are made, and then evaluating the allocation of the resources.
So you haven't had a chance to take a look, is what I'm.
Well, I haven't looked at those issues.
So if confirmed, will you look into these canceled CDC contracts to see if any federal funds have been wasted due to incomplete work? And will you report your findings, whatever they are, back to this committee? Yes or no?
I absolutely commit to work with the committee on their inquiries relative to the work we do.
Yes or no? It's a simple question, sir.
Well, as I've testified, I don't know exactly the contracts you're talking about, but I am going to look into the issues when should I be confirmed.
You will look into the issue and report to the committee what you found.
I will follow the law accordingly and report back to the committee.
I take that as a yes.
Well, as I said, I'll follow the customs of it.
So let me say, I would urge you to consider the important programs at CDC that help states keep their public health programs strong, particularly in a situation where the grants are almost completed. We could begin to see the impact, it seems to me, and do some analysis. To have those grants then summarily dismissed seems more ideological than anything else. If confirmed, you will be responsible for developing and advising the Secretary on the budget for HHS. Do you agree that in public health, investing dollars up front through grants and other programs can often save money down the line?
Senator Warnock, I'm an antitrust lawyer, and as such, I know that there's different economic incentives based on when money flows into different projects. And you want to be able to balance the incentives, particularly when you're spending public dollars, to both incentivize the outcomes that are intended by the allocated resources, but also to do so in such a way so as not to create an environment that festers for waste, fraud, and abuse.
I feel like I gave you a softball question. I asked, do you think investing money up front can often save money down the line?
And I think I just answered the question only in that yes, sometimes
Laurie, let me give you more context. We all know that Secretary Kennedy talks a whole lot about wanting to address chronic disease, and I support that. I've seen it up close as a pastor and as a senator. But let's look at what he's done these last few months. On April 1st, Secretary Kennedy completely demolished the CDC's National Center for Chronic Disease Prevention and Health Promotion, and in the president's budget request, the center was completely zeroed out. This office ran programs at preventing Alzheimer's disease, diabetes. Let me quickly say that $1 out of 4 in our country on health care is spent on people with diabetes. It's the context for which, we see emerging disease and sickness. Heart disease, cancer. Do you think working to prevent Alzheimer's disease, prevent diabetes, when $1 out of 4 in our health system is spent on people with diabetes, does that feel like government waste to you?
Well, I answer that by saying I support Secretary Kennedy's efforts to focus on things like waste, fraud, and abuse, and also to make sure that the funds that are being allocated by Congress are getting to the people who most need them. And sometimes that involves reorganization or refocusing. And I look forward to getting into the position.
Brother Chairman, I want to thank you for giving me some extra time. And so let me just say that an ounce of prevention is worth a pound of cure. And we literally see that in the work that CDC does. And I would hope that you would look at this, that you would take it seriously, because it's literally a matter of life and death. Not to mention the implications for the federal budget. Thank you so much.
Thank you, Senator.
Senator Tillis.